Your child's teacher keeps mentioning ADHD, but something doesn't add up. They can hyperfocus on Lego for hours, but fall asleep after school, during transitions, or whenever routines change. And you've wondered, is this really ADHD or something else going on? Here's the thing, trauma, ADHD, and autism can look almost identical. And if you've been trying to figure out which one you're dealing with, I want to help. Hi, I'm Michael, a registered provisional psychologist at Eckert Centre in Calgary. I work with teens, children, and families on the neurodiversity spectrum, from autism to ADHD to trauma and everything in between. Today I want to talk you through why these three things get confused so often, and what actually makes them different, and how you can start to get some clarity. Okay, let's talk a bit about why these three get confused, why trauma, ADHD, and autism can cause the same surface symptoms: trouble focusing, big emotional reactions, social struggles, and sensory sensitivities. When a child's nervous system is stuck in survival mode from trauma, they can look distracted, not because of an attention deficit, but because their brain is scanning for danger. Chronic stress drains executive function the same way that ADHD does, and autism meltdowns can be misread as trauma responses. The nervous system responds similarly to threat, which is what trauma creates, and to overwhelm, which is what autism and ADHD often involve. That's why it's so hard to tell apart, why a surface-level assessment can miss the picture entirely. So let's talk about trauma first. The biggest clue with trauma is timing. Ask yourself, when did these symptoms start? If there's a big shift after something specific, a divorce, bullying, medical procedure, a move, that matters. Trauma-specific signs also include nightmares about events, avoiding specific places or people, or reenacting difficult experiences in play. Trauma-specific signs also include nightmares about events, avoidance of specific places or people, or reenacting difficult experiences in play. These typically don't show up in ADHD or autism unless trauma is also in the picture. Triggers that make sense also point towards trauma. A child who witnessed a lot of conflict at home might freeze at raised voices. One who experiences abandonment might panic during transitions or drop-offs. Okay, next let's talk about ADHD. ADHD is a neurodevelopmental difference. It's in the wiring, not caused by what happened. The clearest sign is that the pattern has been there since early childhood. When I ask parents, when did you first notice this? They often say, oh, they were always like this. ADHD also responds to structure in specific ways. Timers, visual schedules, movement breaks. These help because they support executive function, not because they create emotional safety. One more thing. Trauma can make ADHD significantly worse, and ADHD kids are at higher risk of trauma. More accidents, more peer rejection, more moments being misunderstood. So if your child has both, they need support for both. Okay, last one, let's talk about autism. Autism involves how the brain processes social information, sensory input, and patterns, and it's present from early development. The key difference from trauma: sensory sensitivities in autism aren't tied to specific memories or events. An autistic child might always struggle with clothing tags or loud environments, not just after something hard happened. Routines also work differently. For an autistic child, predictability brings genuine comfort. For a traumatized child, certain routines might actually feel unsafe if they're connected to past harm. And, importantly, autistic kids face higher rates of trauma. When their natural way of being is consistently misunderstood or corrected, their nervous system learns that the world isn't safe. That's why neurodiversity affirming support matters so much. And finally, those symptoms that you're seeing might be more than one thing. Here's what I really want you to take away from this. It's common to be neurodivergent and to have experienced trauma. These aren't mutually exclusive. Having ADHD doesn't mean you can't also have trauma responses. Being autistic doesn't mean you can't also have ADHD. What matters is finding support that looks at the whole picture, not forcing your child into one category. You don't need a perfect diagnosis to start getting help. Support can begin with understanding. If you're trying to make sense of confusing or overlapping symptoms in your child or teen, we're here to help. At Eckert Centre in Calgary, we offer neurodiversity affirming therapy and comprehensive assessments that look at the whole picture: trauma, ADHD, autism, and how they overlap. You can book a free 15-minute consultation or your first session at the link below. We serve families in person or online in Calgary or across Alberta.